Hello, my name is Ethan, and I'll be talking about cannabis and veterinary medicine. So currently there are a lot of misconceptions about what cannabis is. A lot of doctors suggest that now we're kind of in a almost cannabis renaissance, or at least what my mentor Tim Shu said it'd be. So as we've known, cannabis has been illegal in the United States for a long period of time, a little bit over 50-something years. And it's only been recently that these have been lessening. These restrictions have been getting lesser, and medical marijuana is being more heavily accepted, and recreational use is starting to become more accepted in some parts. So Dr. Tim Shu, he's went to Texas A&M, and he is the founder of Vet CBD, a company that makes CBD products, which we'll get to what that is later. But it's a derivative from marijuana, and it is used for medical benefits. And Dr. Tim Shu has been on places like The Today Show, CNBC, NPR, and the New York Times to talk about his company and just the benefits that CBD can provide for pets. And also in this presentation we'll be covering on how it can help people as well. So what is cannabis composed of? So there's two main ingredients or components of cannabis, if you will. While there are 80 different known cannabinoids, the two that we're going to be concentrating on are THC and CBD. So THC is the one that we all fairly know. It's the psychoactive chemical in cannabis. Its higher THC contents are typically what those who smoke marijuana recreationally like to have. Well, if you go to something like CBD, that has no psychoactive effects whatsoever. Based on evidence, it only suggests that it has everything but positive effects and doesn't really do anything negative. If anything, it's extremely positive. So for the purpose of this presentation, although there are some benefits to THC, we're really going to focus on CBD mainly. So someone I wanted to bring up was Raphael Mechoulam. So Raphael Mechoulam, he's an Israeli organic chemist and professor of medical chemistry at Hebrew University of Jerusalem. So this is the mentor of Dr. Tim Shu, if you will. He's the one that Dr. Tim Shu read most of his reports on, read most of his research on, because for years the only real places that have been doing research into medical marijuana have been Israel and some parts of Europe, but for the most part, because of the United States not legalizing it, it's very difficult to do further study. So he was the first to isolate anandamide. So anandamide is the first known cannabinoid, endocannabinoid, if you will. This is a naturally produced cannabinoid in your body. This is what is normally going on the CB1 and CB2 receptors. So this essentially is, you'll see in a second, but it's not necessarily the same structure, but it does have the same effect as things like CBD and THC. So what is the endocannabinoid system? And we're also going to be talking, for the bulk of this presentation, we're going to be mainly referring to the CB1 receptor, because that's the one that's the most common in the body, the most prevalent, and the one that arguably has the most research on. So there are the CB1 and CB2 receptors. The importance of this can be seen in Rimmelbrand and the knockout mice experiments. And cannabinoids are produced depending on need. So essentially, if your body needs more cannabinoids, more will be produced, and this reduces the gamma amino butyric acid, or also abbreviated GABA, which is the main inhibitory neurotransmitter in mammals. So the CB1 receptor has been shown to be crucial in animals. It's one of the main functions that actually allows us to almost live our lives. So rimonabant, if you don't know, was a drug that went around in Europe, and its main purpose was a weight loss drug. And in clinical trials, it was shown to be extremely effective. But the problem with it was that it was CB1 inverse agonist. So essentially, all the benefits of the CB1 receptor were nulligated from us. They were completely purposeless, and if anything, it caused the opposite effect. So what happened was, those who used the drug did in fact get weight loss similar to that of the mice, but it also came with a risk of problems that went from weight loss to anorexia, depression, and in many cases suicide. So because of this, it showed just the purpose of the CB1 receptor, and a lot of that is just essentially regulating mood. And that's for the CB1 receptor. For the CB2 receptor, it's very similar to something like an opioid receptor. So the way an opioid receptor works on the neurotransmitters, there's a G protein, what's the word I'm looking for, complex donator in the neurotransmitters. So when an opioid hits the site of contact, the synaptic cleft, it will release the G proteins within it and stimulate the effect. This is extremely similar to the CB2 receptor. So it explains the effect of cannabis on the immune system. It was one of the ones they noticed the most on the CB2 receptor. It was mainly found in the peripheral cells of the body, in the nervous system. Unlike the CB1 receptor, which was mainly focused on the brain, this was more peripheral. But there has been evidence suggesting that CB2 receptors are also in the brain. So medical use. So CBD is utilized primarily for pain and inflammation. Examples include hypermotility and ulcer colitis. So one of the benefits of CBD is that it has many of the anti-inflammatory responses. It helps with neuroplasticity. So things like dementia in dogs, it can be extremely helpful for. Things like arthritis, it can also be extremely good for decreasing pain. And things like components like THC have been known to lower doses can treat anxiety and reduce cognitive dysfunction. One of the main things about THC as well is that it also increases appetite. A lot of times during the end of a dog's life, you'll notice that they start eating significantly less. So a lot of times vet CBD is used, at least in the California area where it's mainly produced. It's been shown that this has increased their appetite even towards the time when they're closer to death, when they need it the most. And it's also been helping greatly with seizure control. So cannabis selection. So there's two main strains of strains, a little strong is not the right word. There's two classifications of cannabis. So there's sativa and indica, and in the middle there can be a hybrid, which is a cross between the two. So a sativa has a more citrusy taste / aroma. It's skinnier and brighter leaves, and at least when smoked recreationally, it has an upper effect. It has a head high. It makes the person potentially more energetic. With indicas, however, it has more of a pungent taste aroma. A lot of people will say it smells almost like gasoline. It has thick, dark leaves, and it's a downer. It's more of a downing effect, body high. It's relaxing. For the most part, most of CBD strains are looking more towards indica base, and they're looking for those with low THC contents. So hemp based CBD. So hemp based CBD, a lot of people are starting to know about more, at least in some states that have hemp hemp legalized, but not cannabis. Hemp is used for CBD, and you can just buy it just about anywhere that sells it. The only problem is it's been arguably less effective than cannabis-derived CBD. Hemp is very similar to cannabis, but it has more emphasis on leaf growth. So while it does have the CBD, it really does vary strain to strain. When I talked to Dr. Tim Hsu over the phone, he was saying that his company was looking into doing some type of research into hemp and maybe doing hemp CBD, but for the most part, there really was no reason to, because hemp contained less CBD and just about no THC whatsoever. So it wasn't the best route to go. So for the most part, vet CBD, well, currently vet CBD is only used for cannabis. So marijuana breeding. So how do they actually get what they need? How they get the particular plants that they're looking for? Well, there hasn't been really any GMO-based marijuana strains yet. That's only been in testing and in theory. But for the moment, it's just been traditional breeding patterns. If they're looking for ones that have a higher CBD content than THC, they just keep on breeding over and over until they breed for the correct strain necessary. So precautions. So you always want to consult with a veterinarian to see if that CBD or CBD extracts are appropriate for your animal's condition. One of the things that Dr. Tim Shu wanted to tell me was this is not a cure-all. It's not a cure. It helps treat symptoms, but it does not cure cancer. It will not. Although there has been anecdotal evidence suggesting that it could help, there hasn't been enough research into it. And doing things and saying that it cures cancer is a bold claim, because if you compared something like, let's say urinary bladder cancer, and you compared that to something like leukemia or melanoma, they're completely different in terms of how it affects the body. So suggesting that cannabis can cure all is too much of a claim to really back up. But the main thing is you do not want to administer THC extract to an animal. THC is a biphasic drug. This means that anything that it can cause, like an uplifted mood, it can also do the inverse effect of it, of causing like more anxiety. So if it can treat anxiety, it can cause anxiety in higher dosages. So that's why, for the most part, THC is not used on animals, and for the most part, we suggested almost as animal cruelty. So in terms of THC, I would not recommend giving your animal THC. Marijuana toxicity. So this is actually a fairly common what's what I'm looking for, procedure or ailment that comes into many veterinary hospitals. And the problem is a lot of people don't really think about it, and a lot of people will leave out whether it be their edibles or extracts or what have you out, and their dog can get into it. So when it happens, the dog will appear like it's coming out of anesthetic. You'll notice that it can't really walk. It will be lying down. It will be shaking its head a lot. It causes severe lethargy and personality shift. On the diagram on the right, you can see just the whole host of problems that can go along with it. Hyperactivity, behavior changes, dissociation, mydriasis, pulchuria, sound hypersensitivity. When situations like this happen, at least in the vet hospital I work at, typically the animal will be put in a cage. We'll turn off the lights, and we'll use IV fluids to try and flush it out of their system, and activated charcoal. And the only thing that can really cure this at the end of the day is time. While there have been some anecdotal evidence of owners letting their dogs get into their cannabis and dying because of it, the death is not from the actual marijuana itself. Typically it's from excessive vomiting, and then from the vomiting it would cause lack of oxygen and essentially kill the dog from asphyxiation. So raw bud versus extract ingestion. So if raw bud is ingested, there is little to no effect whatsoever. Some people actually consume it as a superfood. While I don't really know about the claims regarding that, it's still not recommended to give to your pets, but it's not a worry. And that's because delta 9 THC or tetrahydrocannabinol is in its natural state. So Dr. Tim Shu, when I asked about it, he said that THCA is the most natural form. That's when THC is in its acidic form and it's non-psychoactive. For this to become the THC that we all know, it has to be heated up. So most raw cannabis contains very little THC, and that's why if you look at something like edibles or extracts, this becomes significantly more risky. So edible forms of recreational cannabis, the THC is released, and dogs getting into edibles is one of the most common things that people come in for, because people will be leaving them around, the dog will eat it, and the dog doesn't know what they're feeling, so they have to come in. So when THC is heated, things like vaporizers, so already like cooked cannabis, that's also psychoactive. So if a dog eats something like that, that would require the aforementioned treatments. So marijuana tolerance. So many smokers will know, or frequent users of marijuana will know that over time you can build a tolerance to this. By smoking frequently, you require more THC to get to the same level of high, but CBD has very small amounts of THC, so there's been no tolerance, at least in that regard, over time, and they haven't seen this anecdotally. So as of right now, it seems that CBD you can still use the same amount and get the same effect each time. So the dosage can be regulated and maintained. And I just want to show everyone the proven effect of CBD on patients. I apologize. So this is a video showing just the effect of CBD on a patient. So this particular patient is having an epileptic seizure, and CBD is being administered through a nasal spray. CBD can also be administered with a liquid, particularly with vet CBD. That's how it's done, and it's normally just used underneath the tongue to get the desired result. So let's play the video. Okay, so as you can clearly see from the video, the effect of CBD is astronomical. It's one of the most amazing things. That's why Dr. Tim Shu was saying that we're almost in a renaissance for it. Many dogs have seizures themselves. This would be effective. My dog, before he passed away, had a massive seizure before he died. And it's very possible things like this can help these situations. So the main reason why it's able to have this effect is because in seizures, like I said previously, there's a influx of GABA, and when CBD is able to come in and go on the endocannabinoid receptors, it's able to open these channels and continue the flow of neurotransmitters. In this particular case, essentially stopping the seizure almost in its tracks. So I wanted to thank you for listening to this presentation, and have a nice day.